You have 2 copies of ApoE4, a set from your mom and a set from your dad.
And what does that mean exactly?
That means you have an increased risk of Alzheimer's disease.
Researchers have discovered a new link between apolipoprotein E and Alzheimer's disease. This gene is found to be the most significant genetic factor for Alzheimer's risk, but new research has found that it may also be connected to small vessel disease, which causes damage to blood vessels in the brain. The apolipoprotein E4 gene has been in the news lately. Actor Chris Hemsworth recently revealed during an appearance on Good Morning America that he has an 8 to 10 times higher risk of developing Alzheimer's than the general population after undergoing extensive blood work during an episode of his show Limitless. The actor was informed by health specialist Dr. Peter Attia that he has 2 copies of ApoE4. The conversation between these two was featured just recently on Good Morning America.
How much higher?
Probably somewhere between 8 and 10 times higher than that of someone in the general population.
The episode features Chris putting his mental and physical strength to the ultimate test. Dr. Attia estimates that Chris's probability of developing Alzheimer's disease is 8 to 10 times higher than that of the average person since he carries the ApoE4 gene, which is the most significant risk factor gene for the disease. In several different ethnic groups, the E4 variation was the highest known genetic risk factor for late-onset sporadic Alzheimer's disease. However, in some populations, the E4 variation is not associated with an increased risk of the disease. Alzheimer's disease is uncommon among Nigerian people, even though they have the highest observed prevalence of the ApoE4 genotype among groups around the world. This may be because of how low their cholesterol levels are. Nerd alert! In today's episode, we'll dive quite deep into what this gene is and how much it actually increases the risk of developing Alzheimer's disease. ApoE gene helps transport fats in the bloodstream, so having certain variations of this gene increases the likelihood of developing both Alzheimer's and heart disease. Researchers at the University of Cambridge discovered that people with one variation of this gene are more likely to experience small vessel damage as a result of Alzheimer's disease. What is small vessel disease? When we talk about small vessel disease, we are referring to the damage to blood vessels in the brain. It is most commonly seen in people who are suffering from high blood pressure. High blood pressure can lead to damage to the blood vessels in the brain, which can affect the brain's ability to function. This type of damage results in cognitive decline, which can be observed in older adults. It's important to understand that small vessel disease is not the same thing as Alzheimer's disease. The only similarity between these two diseases have in common is that they affect the brain's blood vessels. Small vessel disease has been observed in people with Alzheimer's for decades, which has led many to believe that the two conditions are connected. While there is no proof that these two diseases have a shared cause, researchers have found that a certain genetic variation of the ApoE gene may actually increase the risk of both conditions: Alzheimer's, ApoE, and small vessel disease. One of the most significant genetic risk factors for Alzheimer's disease is a variant of the gene ApoE. This gene is responsible for transporting lipids in the bloodstream. There are 3 different variations of the ApoE gene: E2, E3, and E4. While E2 is found in only 5% of the population, E3 is the most common variation that is found in 95% of the population. The one that Chris Hemsworth was referring to is the E4 gene. E4 is considered the highest variation for Alzheimer's, with an estimated 7% of the population carrying one copy of this variant. Lately, researchers have observed that there is a strong correlation between the E4 variation and Alzheimer's disease. There are 2 potential explanations for this correlation. The E4 variation causes the disease, or the E4 variation is correlated with some other factor that actually causes the disease. Research methods. To determine whether genetic factors such as the ApoE4 cause Alzheimer's, researchers will do a case control study. For this type of research, they will select a group of people who have been diagnosed with Alzheimer's and a control group without the disease. Then, they will analyze their DNA to determine which genetic variations they have. Researchers can then compare the frequency of genetic variations between the 2 groups and look for significant differences. If they find that the variation frequencies in one group are significantly greater than the other, they can conclude that the difference is not due to chance. In this case, they can say that the difference is statistically significant, meaning that it is extremely unlikely that the difference is due to coincidence. The role of a POE in Alzheimer's. One potential explanation for the correlation between the E4 variation and Alzheimer's disease is that the variation itself is causing the disease. This would mean that the E4 is a risk factor for Alzheimer's. There are several pathways through which the E4 could cause Alzheimer's disease. The E4 may increase the amount of amyloid beta in the brain, thus increasing the risk of Alzheimer's. This may increase the amount of amyloid beta in the brain. The E4 may decrease the amount of a POE in the brain, which would decrease the amount of cholesterol delivered by a POE. This would decrease the amount of amyloid beta cleared from the brain. In layman's terms, the significant difference in variation frequencies between Alzheimer's patients and control group proves that the E4 itself is causing the disease. Final words. The significant difference in variation frequencies between Alzheimer's patients and control group is clearly showing that the E4 itself is causing the disease. Chris Hemsworth shared his perspective on what he considers to be his worst worry about this gene variation. The notion that I won't be able to remember the life I've experienced or my wife and children is perhaps my greatest dread, he added. This is definitely my biggest fear.
The idea that I won't be able to remember the life I've experienced, or my wife, my kids. This is probably my biggest fear.
He went on to say that this was one of the things that inspired him to take a vacation from performing so that he could spend more time with them after completing his other obligations. Did you learn anything new from this video? Please let us know in the comments section.